My name is IZZY GERSTENBLUTH. I'm a public health physician and epidemiologist. I head the Epidemiology and Research Unit in the Public Health Department of Curaçao, which is part of the Ministry of Health. And I've been doing that for almost 30 years now. In the Department of Epidemiology, we do lots of different things. We try to set up registration systems. We try to figure out what are the diseases that are impacting our population, what the effect of that is also for the future. We're looking at obesity as a central risk factor for hypertension, for diabetes, for all cardiovascular diseases, and also for joint complaints. And we figured out that those are also the major complaints or major chronic diseases that people are complaining about. And we did this in a research study more than 20 years ago. But we're also focusing on new and re-emerging infectious diseases. Because as you know, the IHR calls for early warning systems and systems to be able to figure out what is going on in your country and what the impact is of newly introduced infectious diseases in your community at large. We work together with different partners in the healthcare field, such as with Professor Deitz from the blood bank. We're looking at HIV and the impact of HIV and looking at new methods on how to arrest the impact of HIV in our populations. There are different things that we are focusing on. The things that are important to us right now are, again, chronic diseases, but also the impact of certain infections. The last couple of years, on a rapid basis, and that makes it interesting because Curaçao is a small island, but it holds true for the Caribbean at large. If you introduce new viral diseases in a previously naive population, we don't really know how it's going to behave and what's going to happen in the populations that we are serving. That makes it interesting for what we're doing now, because in the past couple of years we've had, in recent years, we've had different newly introduced viral diseases that hitherto weren't playing a role on our islands. So it becomes important to figure out why is it doing what it's doing and what are other mechanisms of trying to inhibit it from becoming a disaster. Aside from that, our work on chronic diseases has to continue because we need to find new ways of trying to turn around the Caribbean lifestyle as we know it, that is a cause for obesity and hypertension and diabetes. As in effects for patients specifically, so we're not only talking about policy, right? When we set up registration systems and when we look at research, it's about obtaining information that is important for policy purposes, as well as trying to work out how we can better healthcare for people and what we can do for prevention. I think those are the important issues that play throughout all of the things that we do. And that holds true for infectious diseases, it holds true for chronic illness as well. And to top that off, what we want to try to achieve also for the Research Institute, I believe it's important that even though the island is a small place to live, even for small places on the earth, you need to promote research. Why is that? It's not only to further our knowledge, but it's also to strengthen your own population and trying to determine how you're going to move forward. So we are able to strengthen research as a tool. It also can function as a tool for development of your community and of your health as large.